Hi, I'm Lynn from Strat Pharma. Welcome to our product training videos. These videos are designed to help you understand the indications for our products and how and when to recommend our products for your customers. Today, we are going to talk about professional scar therapy with Strataderm, Australia's #1 scar gel. Silicone gels such as Strataderm are recommended as the first line of therapy for the prevention and treatment of abnormal scars. Strataderm is a gel that dries to form a silicone gel sheet with once daily application. Strataderm is used for the prevention and treatment of abnormal and excessive scars and was developed for use on all types of scars, both old and new, including those resulting from general and cosmetic surgery, trauma, chronic wounds, burns, bites, acne, and other diseases of the skin. Strataderm is as effective as physical silicone sheets, but much easier to use. And Strataderm is more cost-effective than other scar gels because you only need to apply it once a day. Strataderm dries to form a thin, transparent, and durable film that is in constant contact with the scar. Strataderm helps to normalise the collagen synthesis cycle to produce a normal, mature scar. Strataderm softens and flattens the scar, relieves the itching and discomfort, and reduces the redness and discoloration of the scar. Strataderm is easy to use and applied once daily. And the formula for Strataderm is suitable for children, pregnant mums, and people with sensitive skin. And Strataderm has proven clinical results. In a clinical trial conducted in Queensland, Strataderm was compared to pressure garments for use on scars that were caused by burn injuries. Strataderm was found to be less expensive than pressure garments and had less adverse effects, was easier to use, and patients complied better. This is an example of a scar that was caused by a burn injury. This scar was 2 months old when Strataderm treatment was started. After 1 month of treatment with Strataderm, there was a significant reduction in the itching, swelling, and redness of the scar, and the colour of the scar was lighter and its surface was smoother. After 5 months of treatment with Strataderm, there was a significant reduction in the redness again, and the scars were smaller and softer. This is an example of a surgical scar. The scar in the circle was treated with Strataderm, and the other scar was not. These scars were 14 months old when treatment was started, and Strataderm was used for 2 months. After 2 months, there was a significant reduction in the redness, the height, the hardness, the itching, and the tenderness of the scar. To apply Strataderm, ensure that the scar is clean and dry. Apply a very thin layer of Strataderm to the scar and allow to dry. When applied correctly, Strataderm should be dry in 3 to 4 minutes. And if it takes longer, you may have applied too much. Gently remove any excess with a tissue and allow the drying process to continue. Once dry, Strataderm can conveniently be covered with sunscreens and cosmetics and pressure garments or casts if needed. Strataderm only needs to be applied once daily or twice daily if it's in an area where you may wash frequently. For best results, Strataderm should be maintained in continuous contact with the skin 24 hours a day. It's recommended to continue treatment of Strataderm for 60 to 90 days. Larger and older scars may take longer, and continued use is recommended until no further improvement is seen. Strataderm does not need to be rubbed or massaged in, as it doesn't penetrate below the surface layer of the skin. Start using Strataderm once the wound has fully healed, and continue to use Strataderm for 60 to 90 days to prevent and treat abnormal scars. Strataderm is available in 4 convenient sizes for different scar sizes. Strataderm 5 gram is enough to treat a 2 to 3 centimetre linear scar for over 90 days. For larger scars, Strataderm 10 gram is enough to treat a 5 to 7 centimetre linear scar for over 90 days. And for even larger scars, Strataderm 20 gram is enough to treat a 10 to 14 centimetre linear scar for over 90 days. And then the larger 50-gram tube is enough to treat a 6 by 12 centimetre scar area for over 90 days. So when you need to recommend a scar therapy, think of Strataderm, the professional scar therapy, to prevent and treat abnormal scars. Strataderm is Australia's #1 scar gel. Thank you.